the so-called COVID-19 crisis, has been etched into our collective memory as a time of unprecedented disruption. Lockdowns, mask mandates, and mass vaccination campaigns became the new normal, all in the name of public health. We were told that these extraordinary measures were essential to combat an unprecedented threat. But what if the crisis was not actually defined by a virus? It is clear the response to COVID-19, rather than being driven solely by public health concerns, was in fact a military, big pharma, and intelligence national security program. The Covid Dossier explores the disturbing evidence suggesting that the global response to COVID-19 was not simply a matter of public health policy. Instead, it suggests that the crisis was managed using frameworks designed for chemical, biological, radiological, and nuclear CBRN warfare. The Covid Dossier examines shocking and little-known evidence from multiple countries, highlighting how military and intelligence agencies shaped the response and how perverted laws waived human rights. It also identifies key figures who played pivotal roles in promoting and implementing this strategy. By examining significant dates, events, and the actions of powerful actors, the Covid Dossier unveils the alarming reality that the crisis was treated not as a health issue, but as an opportunity to deploy pre-planned militaristic strategies of control. This investigation by Pharma Insider and legal researcher Sasha Latypova and researcher Debbie Lerner is backed by links and citations to all claims and is crucial to understanding the true nature of the COVID-19 crisis and its lasting impact on our societies.
What I would call a coup d'etat against democracy that by forces that include not only the medical cartel, but our military and intelligence apparatus as well. And Sasha has done an incredible job of going into the weeds and documenting exactly how they got away with what they've gotten away with. And this is huge fraud that they have pulled off.
The decision to utilize CBRN frameworks, or the International Legal Framework, against chemical, biological, radiological, and nuclear CBRN terrorism is typically reserved for scenarios involving weapons of mass destruction. This ability to waive the Constitution for a state of exception raises concerns about the potential for these legal loopholes and frameworks to be misused in the future, further eroding human rights and Nuremberg Code. By understanding the mechanics of this response, we can begin to hold those in power accountable and work towards a future where public health is prioritized over militarized solutions. The use of CBRN chemical, biological, radiological, and nuclear terrorism frameworks to manage the so-called COVID-19 emergency represents a profound shift in how governments respond to orchestrated health emergencies. Traditionally, public health issues have been addressed through international collaboration, transparent communication, and a focus on containment and treatment. The response to this so-called crisis, however, deviated significantly from the traditional model. CBRN strategies are inherently militaristic, designed to manage threats posed by weapons of mass destruction. They prioritize security measures, control over information, and rapid deployment of countermeasures, often at the expense of individual liberties and open scientific debate. The decision to apply these frameworks to a pandemic suggests a fundamental shift in thinking, where a rebranded flu is perceived not as a public health challenge, but as a security threat demanding a militarized response. The implementation of CBRN protocols is evident in several key aspects of the global response. Lockdowns, for example, mirror containment strategies used in CBRN scenarios, restricting movement and limiting social interaction to prevent the spread of a perceived threat. Similarly, The rapid development and deployment of vaccines, often bypassing standard safety protocols, aligns with the urgency characteristic of CBRN countermeasure strategies. Furthermore, the use of fear-based messaging and propaganda, often disseminated through government-controlled channels, echoes the psychological operations employed in CBRN scenarios to manage public perception and ensure compliance.
You know, that vaccinated people do not carry the virus, don't get sick.
This militarized approach to communication raises concerns about transparency and the potential for manipulation, as dissenting voices and critical analysis are often silenced in the name of national security. The United States, with its vast military and intelligence apparatus, played a leading role in shaping the global response to what was presented as COVID-19. Early actions taken by the U.S. government, often shrouded in secrecy and justified by national security concerns, set the stage for a highly militarized approach to this so-called crisis. On February 4th, 2020, when the situation was still in its early stages, with limited confirmed cases globally, the U.S. Department of Health and Human Services issued two crucial declarations: the Emergency Use Authorization, EUA, and the Public Readiness and Emergency Preparedness Act, PrEP Act. These declarations, typically reserved for situations involving weapons of mass destruction, effectively classified COVID-19 as a CBRN level threat. This classification allowed for the use of untested vaccines and medical interventions, bypassing traditional safety protocols, and granting legal immunity to those involved in their development and distribution. Furthermore, it paved the way for the militarization of the response, placing key aspects of decision-making in the hands of security and intelligence agencies. The National Security Council, NSC, traditionally focused on matters of national security and foreign policy, assumed a central role in coordinating the domestic response to COVID-19. The Federal Emergency Management Agency, FEMA, an agency designed to manage natural disasters and other emergencies, was designated as the lead federal agency, further solidifying the perception of COVID-19 as a national security threat requiring a militarized response. This militarized approach had profound implications for the way the situation was managed in the United States. Lockdowns were swiftly implemented, often with little regard for their economic and social consequences. Mask mandates and social distancing guidelines, enforced through fines and other penalties, became commonplace, further restricting individual liberties in the name of public safety. Throughout the declared emergency, the control of information has been as crucial as the control of the situation itself. Governments and media work to shape public narratives, illegally suppressing dissenting voices using big tech's monopolistic power. This imbalance of power crushed freedom of speech, attacking the role of independent media, and put public safety at risk by over-reliance on military pharma countermeasures and not considering how to protect individual rights. Behind the scenes, a network of corrupt scientists, policymakers, and international organizations work tirelessly to coordinate a global response. Their efforts are instrumental in developing prototype vaccine and diagnostic countermeasures, sharing and hiding critical data, and providing guidelines that have shaped national policies. These architects of the global crisis and response are exposed in the Covid Dossier as having interests adverse to the people they seek to serve, with inherent conflicts of interest. The declaration of emergency unlocks a windfall of funding for the hardcore cabal. This hardcore health cabal relies on a network of revolving doors between regulators, biowarfare contractors, military, science journals, and big pharma. This alliance is mapped out and documented for all to see. The secret is out. The truth is that military-industrial complex involvement in health procurement is the biggest risk to liberty in history. Emergency powers will be always abused. That is, unless we expose and prevent this public-private partnership as a hardcore cabal that must be prevented in the public interest. The comprehensive response to the declaration of COVID-19 pandemic has been shaped by an intricate web of international organizations and agreements. The U.S. Chemical, Biological, Radiological, and Nuclear Response Framework, established on September 9, 2016, lays the groundwork for the nation's preparedness and response strategies. This framework is part of a broader international effort, including the Medical Countermeasures Consortium. Their role is to collaborate and develop distribution for medical countermeasures across member nations. The Quadripartite Medical Intelligence Committee, or QMIC, is critical in sharing intelligence and coordinating responses among its members. Similarly, NATO's Joint Chemical, Biological, Radiological, and Nuclear Defense Center of Excellence provides specialized training and expertise to bolster collective defense capabilities. On the European front, the EU's Common Security and Defense Policy, or CSDP, integrates health security into its broader security and defense strategies, ensuring a unified and coordinated response across the continent. Understanding these frameworks and organizations is essential for grasping the full scope of the global response to the pandemic. For more detailed information and quick links to these resources, please refer to the description below this video. Stay informed and stay vigilant, as knowledge is our first line of defense in reclaiming our health and freedom. As we move forward, unveiling the truth within the Covid Dossier, exposing and reforming the broken health law system is critical. Transparency, science integrity, and a commitment to Nuremberg Code will be essential in rebuilding public trust.